Welcome to Byobo, Uganda, headquarters of Women's Microfinance Initiative. Village women gather every day at the WMI building to receive loans, make payments, attend business training, or for other program activities. Over the past 9 years, WMI has issued nearly 30,000 loans, totaling more than $4 million. Since launching the loan program in 2008, we have learned a lot about what it takes for rural women to succeed in running a business, what kind of support, training, and financial access they need. But we've also learned a lot about another critical factor that can mean the difference between a business that thrives and a business that fails. That critical factor is good health. Without her health, a village woman cannot run a business, care for a large family, and do household chores like hauling water and collecting firewood. Mothers in the loan program are the chief cooks, cleaners, shoppers, nurses, and teachers for their families. The well-being of so many people depends on them staying healthy. That's why WMI has partnered with local medical professionals to bring access to medical screening to the villages where these women live and work. They are called RAIN Uganda, which stands for Responding to HIV/AIDS and Intervening for the Needy.
We have helped communities to clear out the myths and the misconceptions, because before RAIN Uganda taking on, people had a misconception that people with blood group O cannot get HIV.
We have worked with the WMI in a number of stations, and it's a nice kind of working relationship that we have established, and we are always very willing to be there to work with the WMI, because one, we respect the mobilization that WMI always has. They really mobilize people for us.
What we do basically is we test for HIV and syphilis. Those are at least compulsory for every person who comes. Then malaria, random blood sugar. So what happens is when the patient comes, we withdraw the blood. Then after 15 minutes, we give them the results and send them back to the counselors, who will tell them what to do next.
We carry out cervical cancer and breast screening, and indeed we got very many mothers who had the problems. So what we could do, we screen them, and when we realize they have problems, we send them to Mbali Regional Referral Hospital for treatment. Now, it's very important because many of them had it, and cancer is a silent killer, whereby if you have not examined, it is very difficult for you to see a client and say this one has this condition. So screening is very important because it helps us to identify a client. And with cervical cancer, it's a bit unique compared to other types of cancer because for it, when diagnosed early, it's curable.
Olive Olimbwa, I'm 52 years old. My sight started not being so clear. I started seeing bigger letters, but smaller ones, no. With the help of eyeglasses, I can see any size of any font of letter. But without it, there's a time when I went to the bank. I wanted to make a withdrawal, but I'd forgotten the glasses. So it was really hard for me until I went outside in the sunshine, where there's at least much light. I wrote like that, but some letters were not on the line. But with the help of these eyeglasses now, I can read, I can write.
So the reason why we incorporate this kind of screening and this table is because there are those diseases that we are talking about, the non-communicable ones, that are really silent killers. When somebody is living with hypertension, the only time they show up is when they are getting complications. Then sometimes also the sugars are quiet, they're a little bit silent. So we really felt that since we've come to meet a community like this, we give them an opportunity to have the test and the screening, so they can know that, the status of their health.
My name is Aline Neumbe. I carry out a business of Bogoya and a small hotel. At first, I was not okay in my life. But as Rain Uganda came in touch with WMI, so they kept on testing us on various diseases, e.g. cancer, high blood pressure, HIV testing, eye testing. So as I tested myself, I found myself I was in good health. So as for now, I'm running my business in good health with no fears. So that is how I'm working with WMI together with Rain Uganda.
Kodina,